Cardiologist warns, these 5 pills increase the risk of heart attack and stroke in the elderly. A stark reality confronts many individuals over 60 who rely on daily medications, believing these pills protect their health. Tragically, for some, these very substances are silently damaging the heart, potentially leading to sudden, unforeseen death. This is not mere speculation, but a grim truth evidenced by countless cases. Consider a 64-year-old individual who, tragically, passed away merely minutes after taking their prescribed heart pills on a quiet morning. There was no heart attack, no stroke, no accident. This person simply collapsed while performing a routine task, a victim of sudden cardiac arrest. The subsequent investigation often reveals a disturbing pattern. The heart was literally poisoned by a combination of chemical substances ingested regularly for years under the impression of safeguarding health. This unfortunate individual is not an isolated case, but represents millions of people over the age of 60 who are being slowly undermined by the very medicines intended to save them. Even more unsettling is the possibility that similar potentially dangerous medications might currently reside in many household cabinets. Insights gained over decades in cardiology reveal a silent epidemic of deaths directly caused by medical treatments themselves. This phenomenon is sweeping through the elderly population, largely unnoticed by public headlines. These are grandparents who suddenly die after years of taking blood pressure medication. They are healthy retirees who develop inexplicable heart failure after starting preventative treatments. They are once vibrant individuals who become dependent on a cocktail of drugs that slowly erode their hearts from within. The pharmaceutical industry generates vast profits, often by fostering this cycle of sickness and dependency. There is compelling evidence that exposes how this occurs. The following information will highlight 5 of the most potent medications known to compromise the hearts of older adults globally. It will explain the precise mechanisms by which each can be detrimental, often in ways that are not commonly discussed, and will present natural alternatives that offer genuine benefits without turning individuals into unwitting pharmacological experiments. Everyone has a right to understand what they are routinely putting into their bodies. Many individuals have suffered because they were never informed of these truths. However, there is still an opportunity to safeguard one's own life and potentially the lives of loved ones with the knowledge that is now accessible. The dangers of statins. The first medication that often poses a silent threat to millions over 60 is widely prescribed and considered essential for heart protection. Approximately 73% of older adults take statins daily, believing they are investing in their longevity. These miracle drugs, such as atorvastatin, simvastatin, and rosuvastatin, are promoted by conventional medicine as vital for preventing heart attacks and strokes by lowering cholesterol. The individual mentioned earlier, whose tragic passing occurred, had been taking 40 milligrams of atorvastatin for 3 years, a prescription provided by a respected professional who assured her it was necessary for the rest of her life. What is often overlooked, or perhaps not fully understood by many practitioners, is that statins can directly damage the heart muscle. This can lead to a condition known as statin-induced myopathy, which may escalate to fatal rhabdomyolysis, a severe breakdown of muscle tissue that releases dangerous toxins into the bloodstream. The individual's demise was not from heart disease in the conventional sense, but from statin poisoning that essentially degraded her heart from the inside out. The mechanism by which statins can harm older individuals is both straightforward and devastating, involving the blockage of a crucial substance, coenzyme Q10. This coenzyme is absolutely vital for energy production within heart cells. Statins primarily function by inhibiting an enzyme in the liver that reduces cholesterol production. However, this same enzyme is also critical for the synthesis of coenzyme Q10, which provides the necessary fuel for heart cells to contract and pump blood effectively. Long-term use of statins over months or years can effectively deplete the heart of the energy it needs to function properly. This can lead to progressive heart failure, a condition that develops so gradually it is often misattributed to the natural aging process. Individuals over 60 naturally have reduced levels of coenzyme Q10, and when statins are introduced, this deficiency can become critically low, potentially leading to fatal cardiac energy deficits. Independent research indicates that statins can lower coenzyme Q10 levels by as much as 40% in just 30 days. This information, however, has often been minimized by the pharmaceutical industry, ostensibly to protect substantial profits. The situation becomes even more precarious when considering that statins also impede cholesterol production in the brain, where cholesterol is fundamental for neurological function and maintaining the integrity of cell membranes. Contrary to widespread belief, cholesterol is not inherently harmful. It is a vital substance produced by the body itself, essential for repairing damaged arteries, synthesizing hormones, and ensuring proper brain function. By artificially suppressing cholesterol production with statins, the body may be forced to break down its own muscle tissue to obtain necessary components for vital functions, a process known as protein catabolism that can literally consume heart muscle. The individual's experience before her passing illustrated classic signs of statin toxicity, including unexplained chronic fatigue, muscle pain often dismissed as age-related, progressive mental confusion, and episodes of weakness that were not adequately investigated by healthcare providers. These symptoms were, in hindsight, indicators of a slow, systemic poisoning that tragically ended a life that could have been extended by many years. Furthermore, statins have been linked to the development of type 2 diabetes in a significant percentage of older users. This creates a dangerous cycle where the medication intended for the heart can induce diabetes, which in turn causes further, more severe damage to the heart. Studies have shown that statins can increase the risk of developing diabetes by 48% in postmenopausal women, with an even higher risk in men over 65. When statin-induced diabetes occurs, the typical response is to add diabetes medications, leading to polypharmacy, a toxic regimen that further burdens an already aging liver and kidneys. The individual had developed inexplicable diabetes after 18 months of statin use. Instead of questioning the link, her provider simply prescribed metformin, adding another chemical to an already overloaded system. The combination of statins, diabetes medication, and blood pressure medications, often needed because statins can also cause hypertension, created a perfect chemical storm that her 64-year-old heart simply could not withstand. For anyone over 60 currently taking statins, it is crucial to understand these potential risks. However, there are safer strategies to protect cardiovascular health without becoming another statistic of treatment-induced harm. It is critical never to discontinue statins abruptly without professional medical supervision, as withdrawal can provoke severe arterial inflammation, potentially triggering heart attacks. Instead, a collaborative approach with a healthcare provider is recommended to gradually reduce the dosage while integrating scientifically supported natural protocols for heart health. Immediate supplementation with high-quality coenzyme Q10, 100-200 mg daily, is vital to mitigate the energy deficiency caused by statins. Incorporating chelated magnesium, 400 mg daily, can help guard against muscle cramps and arrhythmias. Adopting a diet rich in healthy fats, such as extra virgin olive oil, avocado, and wild fish, provides the essential building blocks the body needs to produce cholesterol naturally and appropriately. Most importantly, it is wise to critically examine the widely propagated notion that high cholesterol is always detrimental. Research suggests that older adults with moderately elevated cholesterol levels, 200-280 mg/dl, often exhibit greater longevity and superior cognitive function compared to those with artificially lowered cholesterol. The individual discussed earlier might still be alive today if questions had been raised about the actual necessity of statins and if effective, natural alternatives that truly safeguard the heart rather than incrementally diminishing it had been pursued. The risks of anti-inflammatories, NSAIDs. The Second category of medications that frequently damages the hearts of older adults and often provokes even greater concern comprises non-steroidal anti-inflammatory drugs, NSAIDs. An astonishing 84% of individuals over 60 consume these readily available drugs, often viewing them as benign because they are sold without a prescription. This includes common medications such as ibuprofen, diclofenac, and naproxen, which older individuals often take daily for joint pain, headaches, or minor discomforts, unaware that each dose can be a form of cardiovascular poison. The pharmaceutical industry has invested heavily in conveying the message that these drugs are gentle and safe due to their over-the-counter status. However, the reality is that NSAIDs contribute to more deaths among people over 60 than many illnesses considered fatal. The individual mentioned earlier also took 600 milligrams of ibuprofen 3 times a day for arthritis in her knees, a dosage her specialist deemed perfectly safe for long-term use. What was not explained is that NSAIDs block essential enzymes, specifically KOX1 and KOX2, which are crucial for protecting the arterial lining and regulating blood pressure. This blockage can lead to sudden hypertension, fluid retention, and cardiac overload, potentially culminating in sudden death. The mechanism by which anti-inflammatories undermine heart health is alarmingly simple and has been obscured for decades to safeguard an industry worth billions annually. NSAIDs inhibit the production of prostaglandins, natural substances that not only regulate inflammation, but are also vital for safeguarding the inner lining of the coronary arteries and maintaining the body's salt and water balance within the kidneys. When these protective prostaglandins are suppressed, the natural defense mechanism of the arteries is compromised, rendering them susceptible to damage, inflammation, and the formation of dangerous clots. Simultaneously, NSAIDs compel the kidneys to retain sodium and water, which elevates blood volume and can cause blood pressure to surge to dangerously high levels within days. Older individuals, whose kidneys typically operate at 50–70% of their peak capacity, are particularly vulnerable. Their systems may be unable to adequately compensate for this fluid overload, leading to conditions such as pulmonary edema, congestive heart failure, and abrupt cardiac arrest. Suppressed studies reveal that merely 7 days of ibuprofen use in individuals over 65 can increase the risk of a heart attack by 78%. Unfortunately, this crucial information has often not reached the public, as its disclosure could significantly impact one of the industry's most lucrative revenue streams. The situation escalates in danger when considering that most seniors frequently take NSAIDs in conjunction with other medications, leading to pharmacological interactions that can become fatal within hours. NSAIDs can dangerously amplify the effects of blood pressure medications, causing precipitous drops in pressure that may result in fainting, severe falls, and cerebral ischemia. When combined with anticoagulants such as warfarin, which many older adults take to prevent clots, NSAIDs can multiply the risk of internal hemorrhages by 400%, potentially leading to fatal gastrointestinal bleeding that can claim a life within a few hours. The combination of NSAIDs with diuretics and blood pressure medications, which is exceedingly common among older individuals, creates a hazardous triad that can overwhelm the kidneys, leading to complete renal failure. The individual in our discussion was taking precisely this combination: ibuprofen for arthritis, a medication for blood pressure, and a diuretic. This lethal synergy created a perfect storm of kidney toxicity and cardiovascular strain, culminating in the cardiac arrest that tragically ended her life. Her healthcare providers never thoroughly assessed the compatibility of these 3 medications, with each specialist prescribing within their own domain, without considering the cumulative effect on an already aging heart. Anti-inflammatories can also cause severe gastrointestinal damage, which may result in death from hemorrhage, especially in older individuals whose stomach lining is already thinner and more fragile. Each year, over 100,000 people in the US are hospitalized for gastrointestinal bleeding induced by NSAIDs, and 16,500 of them die, a mortality rate higher than that caused by AIDS. These alarming statistics are often deliberately obscured because revealing the full truth about NSAIDs would not only challenge the pharmaceutical industry, but also undermine the credibility of thousands of healthcare professionals who routinely prescribe these compounds. Bleeding can commence silently, without noticeable symptoms, and by the time individuals experience clear signs like dark stools or vomiting blood, they may have already lost a significant amount of blood, leading to potentially fatal hypovolemic shock. The individual had reported experiencing heartburn in the weeks prior to her passing, a symptom she treated with antacids, unaware that it signified the ibuprofen was eroding her stomach lining. The post-mortem examination not only revealed a heart damaged by statins, but also multiple gastric ulcers caused by the NSAIDs, which were mere days away from perforating and causing fatal peritonitis. Safely eliminating anti-inflammatories from one's life can protect both the heart and overall well-being. There are significantly more effective natural alternatives that do not carry the risk of sudden death. If over 60, especially when also taking other cardiovascular medications, it is advisable to stop taking any NSAID immediately, as interactions could prove fatal. For managing pain and inflammation, highly absorbable curcumin, 500 milligrams twice daily with piperine for enhanced bioavailability, has shown greater efficacy than ibuprofen in reducing inflammation, without any adverse cardiovascular effects. Supplementing with high-quality wild fish oil, providing 2 to 3 grams daily of EPA and DHA, acts as a potent natural anti-inflammatory that supports, rather than attacks, the heart. Implementing physical therapies such as ice, heat, massage, acupuncture, and low-impact exercises can address the underlying causes of pain instead of merely masking symptoms with potentially harmful drugs. For acute, occasional pain, low-dose paracetamol used for short durations, while not ideal, is considerably safer for the heart than any NSAID. Crucially, it is important to investigate and address the root causes of inflammation, which can include magnesium deficiencies, imbalances in omega-3 fatty acids, food intolerances, chronic stress, and heavy metal toxicity. The individual in our narrative could be alive and free from pain today if she had explored these natural solutions instead of uncritically relying on the substances prescribed by conventional medicine. The hidden dangers of proton pump inhibitors, PPIs. The third category of medication subtly harming the hearts of older adults involves proton pump inhibitors, PPIs, such as omeprazole, pantoprazole, and esomeprazole. These stomach protectors are routinely taken daily by 68% of people over 60 for heartburn and reflux, often with the belief that they are entirely harmless. The pharmaceutical industry promotes these medications as essential for shielding the stomach, particularly when individuals are on other drugs. However, the alarming reality is that PPIs can damage the heart through mechanisms so subtle and progressive that the eventual passing often appears to be a natural event. The individual referenced earlier took 40 milligrams of omeprazole every morning for 4 years. Initially prescribed to protect her stomach from anti-inflammatories, it was then maintained simply because it reportedly did no harm, according to her gastroenterologist. What was not widely recognized or perhaps acknowledged is that PPIs can induce severe magnesium deficiency, which in turn can lead to fatal cardiac arrhythmias. Furthermore, long-term use of these drugs can elevate the risk of heart attack by 70% in older individuals. Her tragic end was ultimately attributed to a ventricular arrhythmia, directly caused by the magnesium depletion resulting from years of omeprazole use. The mechanism by which proton pump inhibitors can compromise the health of older individuals is disarmingly simple, revolving around their impact on the absorption of nutrients vital for cardiac function. PPIs operate by blocking the production of gastric acid. However, this acid serves purposes beyond digestion. It is indispensable for absorbing magnesium, vitamin B12, iron, calcium, and vitamin D from food. When stomach acid production is suppressed for extended periods, significant nutritional deficiencies can develop, which silently undermine cardiovascular health. Magnesium deficiency is particularly perilous because this mineral is crucial for over 300 enzymatic reactions in the body, including the vital contraction and relaxation of the heart muscle. Older individuals typically already have naturally lower magnesium levels, and the addition of PPIs can exacerbate this depletion, potentially leading to sudden cardiac arrest due to ventricular arrhythmia. Independent research indicates that PPI use for over a year can reduce magnesium levels by as much as 60%. This information, however, has been largely unhighlighted by the pharmaceutical industry to preserve a market worth billions annually. The vitamin B12 deficiency caused by PPIs is equally detrimental to the heart, potentially leading to a condition called megaloblastic cardiomyopathy, where the heart muscle physically deteriorates due to the lack of this essential vitamin. Vitamin B12 is crucial for energy generation within heart cells and for maintaining the heart's electrical system, which dictates heartbeat rhythm. When PPIs obstruct B12 absorption, the heart is compelled to function with a chronic energy deficit, eventually progressing to heart failure. The individual in our story had experienced inexplicable fatigue and occasional palpitations over her last 2 years, symptoms her healthcare providers dismissed as normal aging without investigating B12 levels. Vitamin B12 deficiency also leads to elevated homocysteine levels, a toxic amino acid that directly damages coronary arteries and significantly increases the risk of fatal blood clots. Individuals who use PPIs for over 2 years often exhibit homocysteine levels 40% higher than the general population, fostering chronic arterial inflammation that can culminate in sudden cardiovascular events. PPIs also interfere with the metabolism of clopidogrel, Plavix, an anticoagulant often prescribed to older adults to prevent clots, rendering it completely ineffective and leaving the patient susceptible to heart attacks and strokes. This dangerous drug interaction has been recognized for over a decade, but is frequently overlooked by healthcare professionals who prescribe both medications concurrently. When the individual began taking clopidogrel after an episode of angina, none of her providers questioned the interaction with the omeprazole she had been using for years. Consequently, she believed she was protected against clots, yet she remained fully vulnerable because the omeprazole was preventing the activation of clopidogrel in her liver. Furthermore, PPIs elevate the risk of Clostridium difficile infections, a bacterium that can cause potentially fatal colitis, particularly in hospitalized older adults. The systemic inflammation resulting from these infections can trigger cardiovascular events in already compromised individuals, initiating a cascade of complications often leading to death. Safe discontinuation of PPIs can be life-saving, but must be managed gradually to prevent a rebound effect of excessive stomach acid production. For those who have used PPIs for more than 3 months, a suggested approach is to reduce the dose by 50% for 2 weeks, then alternate days for another 2 weeks before ceasing completely. Concurrently, natural protocols should be implemented to address reflux at its root. Eliminating inflammatory foods like gluten, dairy, and processed items, which can contribute to intestinal permeability, is a crucial first step. Incorporating high-quality digestive enzymes, particularly betaine HCl for older individuals, can restore proper digestion without blocking essential bodily functions. Supplementing with chelated magnesium 400 mg, sublingual methylcobalamin B12 1000 micrograms, and vitamin D3 with K2 can correct the deficiencies commonly caused by PPIs. High-potency probiotics are beneficial for restoring gut microbiota damaged by chronic acid suppression. For immediate reflux symptoms, occasional use of baking soda or soothing chamomile and ginger teas can provide relief without interfering with vital stomach functions. The individual in our example might still be with us today if it had been explained that her stomach protector was slowly damaging her heart and that safe natural methods exist to heal reflux without daily ingestion of medications that impair the absorption of life-sustaining nutrients. Natural approaches to vitality and cognitive function. Before discussing the next critical medications, it's important to recognize that many individuals experience a decline in energy, mental clarity, or overall vitality as they age. Often, this is not an inevitable part of aging, but can be linked to various factors, including nutrient deficiencies or the cumulative effects of certain substances. Scientific understanding points to several natural compounds that can significantly contribute to restoring mental sharpness, sustained energy, and physical vigor. For instance, certain plant extracts are well known for their capacity to support cardiovascular health and aid the body in maintaining optimal blood pressure levels. Other natural ingredients can help optimize the body's processing of sugars, thereby promoting more stable energy throughout the day and mitigating the exhausting peaks and valleys. There are also specific botanicals that are recognized for nourishing brain function, potentially enhancing focus, memory, and overall cognitive acuity. Specific natural compounds, such as those found in grapeseed and blueberry extracts, are highly regarded for their ability to strengthen blood vessels and support healthy brain function as well as vision. The harmonious interaction of such thoughtfully chosen natural elements can lead to a profound positive shift in daily well-being and functionality. These natural methods are generally free from synthetic chemicals, do not create dependency, and are safe for long-term integration into a healthy lifestyle. Many individuals who incorporate these natural supports report experiencing improvements in energy levels in the morning, enhanced sleep quality at night, clearer thought processes during the day, and a general sense of vitality they may not have felt in years. Understanding these safe and effective alternatives is crucial for reducing reliance on potentially harmful medications and reclaiming one's innate health. The risks of beta blockers. The fourth category of dangerous medications on our list, which often causes considerable concern, comprises beta blockers, including metoprolol, atenolol, and propranolol. These medications are prescribed to approximately 45% of individuals over 60 for blood pressure management, often with promises of cardiovascular protection. However, they can inadvertently create a profound risk within the body. While these drugs are promoted as essential for blood pressure control and heart attack prevention, a significant truth often unrevealed by the pharmaceutical industry is that beta blockers can contribute to progressive heart failure, the onset of diabetes, severe depression, and even sudden death during sleep due to extreme bradycardia and abnormally slow heart rate. The individual in our narrative was taking 50 milligrams of metoprolol twice daily, prescribed following an episode of high blood pressure. In the weeks leading up to her passing, she had complained of extreme fatigue, shortness of breath upon exertion, and episodes of dizziness, all classic indicators that the beta blocker was significantly impeding her heart's function. The post-mortem examination revealed that her heart had become dangerously slow and weak, unable to pump blood adequately, a condition directly caused by chronic beta blocker use. Beta blockers compromise the health of older individuals through a strikingly simple mechanism. They block beta-adrenergic receptors in the heart. This prevents the heart from responding appropriately to adrenaline and noradrenaline signals, which are essential for maintaining proper heart function, especially during stress or emergency situations. When taken chronically, beta blockers effectively inhibit the heart's natural ability to accelerate when necessary, such as during physical activity, stressful events, or medical crises. For older individuals whose hearts already function with reduced capacity, this artificial suppression can be fatal. During sleep, when the parasympathetic nervous system naturally slows the heart rate, beta blockers can induce extreme bradycardia, potentially leading to sudden cardiac arrest. The individual had begun using a heart monitor in her final weeks because she perceived her heart stopping during the night. Both she and her healthcare providers attributed these episodes to anxiety, when in reality, They were clear signs that the metoprolol was causing dangerously long pauses in her heartbeat. The situation becomes even more perilous when considering that beta blockers can induce insulin resistance and type 2 diabetes in a concerning proportion of older users. This creates a vicious cycle where the heart medication causes diabetes, which then exacerbates heart damage. Beta blockers obstruct the signals that normally stimulate insulin release and also diminish tissue sensitivity to insulin. This forces the pancreas to work excessively to maintain normal blood sugar levels. Over time, this overload can lead to pancreatic exhaustion and overt diabetes, a condition that dramatically multiplies the risk of cardiovascular disease. The individual in our example had developed prediabetes after 18 months of metoprolol use, yet her healthcare providers did not connect the dots between the medication and her metabolic deterioration. Beta blockers can also mask the symptoms of hypoglycemia, preventing diabetic individuals from recognizing dangerously low blood sugar levels, which can result in fatal hypoglycemic comas, particularly during sleep when there is no one to monitor them. Beyond physical effects, beta blockers are linked to severe depression and cognitive decline in older adults through mechanisms that extend beyond the side effects listed on drug labels. These medications can cross the blood-brain barrier and block beta receptors in the brain, which are crucial for the production of neurotransmitters like serotonin and dopamine. This can lead to a drug-induced chemical depression so profound that it may tragically result in suicide, particularly in older men who often face social isolation and other health challenges. The reduction in cerebral blood flow caused by beta blockers also contributes to progressive cognitive decline, with many individuals developing symptoms that mimic early stages of dementia. The individual in our story had become progressively more depressed and confused in her final months. Her family attributed these symptoms to normal aging and stress, unaware that they were direct consequences of beta blocker use. The confluence of depression, extreme fatigue, and cognitive difficulties severely diminished her quality of life to the point where she had expressed to her daughter that she no longer saw a purpose in living. A tragic statement now understood to be directly linked to the neurotoxic effects of her medication. For anyone currently taking beta blockers, it is important to understand the potential risks. However, there are strategies to transition away from these medications safely without triggering a dangerous rebound effect. It is crucial never to stop beta blockers abruptly, as this can cause severe rebound hypertension, dangerous tachycardia, rapid heartbeat, and even heart attacks. Instead, working with a knowledgeable healthcare provider to gradually reduce the dose over 4 to 6 weeks is recommended, while simultaneously integrating natural protocols for cardiovascular support. Immediate supplementation with coenzyme Q10 and chelated magnesium is vital to support natural heart function. Adding taurine can also strengthen the heart muscle without suppressing its responsiveness. Implementing deep breathing exercises and meditation can naturally activate the parasympathetic nervous system, helping to reduce blood pressure without relying solely on medication. Eliminating refined salt and processed foods while increasing potassium intake through fresh vegetables helps naturally balance blood pressure. Stress reduction techniques such as gentle yoga, acupuncture, and massage can sustainably lower blood pressure without side effects. Most importantly, investigating and addressing the root causes of hypertension, such as insulin resistance, magnesium deficiencies, heavy metal toxicity, sleep apnea, and chronic stress is key. The individual in our story could be alive, energetic, and content today if questions had been raised about the actual necessity of beta blockers and if natural alternatives that genuinely protect the heart rather than progressively slowing it down had been offered. The dangers of anticoagulants. The fifth and final category of concerning medications, and perhaps the most startling, involves anticoagulants such as warfarin, rivaroxaban, apixaban, and dabigatran. These are drugs that a significant majority, 91%, of healthcare providers automatically prescribe for people over 60, believing they are saving lives, when in reality they can unknowingly initiate a slow and painful decline. These clot protectors have transformed millions of older adults into individuals living with a constant risk of severe bleeding, capable of bleeding to death from even minor trauma. The pharmaceutical industry has successfully convinced both healthcare professionals and patients that these drugs are indispensable for preventing strokes and embolisms. However, the alarming truth, often unaddressed, is that anticoagulants cause more deaths in older individuals through fatal hemorrhages than they prevent through clot reduction. The individual whose story we followed was taking 20 milligrams of rivaroxaban daily, prescribed after an episode of atrial fibrillation. In the weeks prior to her passing, she had developed unexplained bruising, gum bleeding, and recurrent nosebleeds, symptoms that her healthcare providers considered normal for someone on anticoagulation therapy. The reality, however, was that these were clear signs that her blood was excessively thin, making her vulnerable to fatal internal hemorrhage from any minor impact, which tragically occurred on the night of her death. The mechanism by which anticoagulants can be lethal for older individuals is disturbingly predictable, involving the disruption of the delicate coagulation balance that is essential for survival. These drugs function by blocking key factors in the coagulation cascade, thereby preventing the blood from forming clots, not just when dangerous, but also when necessary for everyday protection. For older individuals whose blood vessels are typically more fragile and whose livers metabolize medications more slowly, this artificial interference can transform any minor trauma into a catastrophic hemorrhage. Chronic use of anticoagulants after the age of 60 means living constantly on the precarious edge between preventing clots and succumbing to fatal bleeding. What makes this situation even more critical is that newer anticoagulants, such as rivaroxaban and apixaban, often lack an effective antidote. If bleeding begins, there may be no immediate way to reverse the drug's effects, potentially leading to death, while healthcare professionals are left with limited options. The individual in our narrative had sustained a minor fall in her garden 2 days before her death. In a healthy person, this would likely cause only a bruise, but for someone on strong anticoagulation, it resulted in progressive intra-abdominal hemorrhage that culminated in sudden death. The situation becomes even more dangerous when considering that older individuals on anticoagulants often develop silent gastrointestinal bleeding that can persist for weeks or months before becoming critical. The lining of the stomach and intestines in older adults is naturally thinner and more susceptible to damage. When potent anticoagulants are added, any minor irritation can cause bleeding that struggles to stop effectively. Thousands of people die annually from severe anemia caused by chronic gastrointestinal bleeding that goes unnoticed until treatment is too late. The bleeding can be so gradual that the individual simply experiences increasing fatigue and weakness, symptoms often dismissed as normal aging, while they are, in fact, indicative of daily internal blood loss. The individual had complained of increasing fatigue and pallor in recent weeks, signs that, in retrospect, clearly indicated progressive internal bleeding caused by rivaroxaban. Anticoagulants also interact dangerously with common medications like aspirin and other anti-inflammatories, exponentially multiplying the risk of fatal hemorrhages. Despite this, many healthcare providers prescribe these potentially lethal combinations without adequately considering the severe consequences. Anticoagulants can also paradoxically contribute to arterial calcification. This means that the very medication intended to protect against clots can, through mechanisms not fully acknowledged by conventional medicine, accelerate the hardening of the arteries. Warfarin, one of the oldest anticoagulants, blocks vitamin K, which is essential not only for blood clotting, but also for directing calcium into bones and away from arteries. Chronic blockage of vitamin K can force calcium to deposit in arterial walls, making arteries as rigid as iron pipes and more prone to rupture, less able to adapt to changes in pressure. Newer anticoagulants can cause similar problems through different pathways, all leading to accelerated cardiovascular deterioration disguised as treatment. The individual in our story had developed severe arterial stiffness during the years she used rivaroxaban, a condition that contributed to the hypertension episodes that ultimately overloaded her heart, already weakened by other medications. The profound irony is that the medications prescribed to protect her heart actually hastened its decline, creating a cycle of pharmaceutical dependency that tragically led to premature death. If you are currently taking anticoagulants, it is vital to understand that this involves navigating a complex landscape where the risks of fatal hemorrhage can outweigh the benefits of clot prevention, particularly if you are over 70. Discontinuation of anticoagulants must be performed under strict medical supervision. However, natural alternatives exist that can offer cardiovascular protection without transforming one into a constant bleeding risk. Implementing a natural anti-inflammatory regimen is highly recommended, utilizing high-absorption curcumin, wild fish oil, and aged garlic extract, which can naturally reduce platelet aggregation without completely inhibiting the coagulation process. Adding nattokinase, a natural enzyme known for safely and reversibly dissolving clots, offers an alternative to synthetic anticoagulants. Supplementing with vitamin K2, if not on warfarin, is crucial for directing calcium to bones and preventing its deposition in arteries. Chelated magnesium can help relax blood vessels and reduce the tendency for excessive coagulation. Eliminating pro-inflammatory and pro-coagulant foods such as refined sugar, processed vegetable oils, and grain-fed animal meats is also beneficial. Practicing low-impact exercises improves circulation naturally without the risk of trauma. Most importantly, it is essential to investigate and address the underlying causes of a tendency for clotting, which can include chronic inflammation, insulin resistance, nutritional deficiencies, and heavy metal toxicity. The individual in our example could be alive today, with healthy blood flow and normal clotting ability, if these natural alternatives had been considered instead of condemning her to a precarious existence with constant hemorrhage risk. Responsible medication use and empowering your health. It is crucial to clarify that none of the medications discussed are inherently without purpose or completely useless. Each has specific functions and can be life-saving when prescribed appropriately at the correct dose for the right condition and for the necessary duration. The significant issue observed over decades in cardiology is not with the medications themselves, but with their unchecked, prolonged, and often unnecessary use, particularly in older individuals whose bodies process substances differently. If a healthcare provider prescribed any of these medications after a careful assessment of specific risks and benefits, it is imperative not to stop taking them abruptly based solely on this information. Sudden discontinuation can be as dangerous as inappropriate use. The real danger lies in the epidemic of irresponsible self-medication prevalent in society. This includes older individuals taking anti-inflammatories habitually for any minor discomfort, using omeprazole for years without adequate medical oversight, or continuing statins decades after the initial prescription without proper re-evaluation. The individual tragically lost in our story did not suffer due to malicious intent from her healthcare providers. Her death resulted from a combination of medications that were never reviewed holistically, some of which she might have started on her own, and others she continued well beyond their necessary duration. The core problem is that our medical culture often views medications as permanent solutions to temporary problems, when in reality, most should be used for limited periods, while the underlying causes of health issues are identified and addressed. The vital message is this: medications are powerful tools that can save lives when used judiciously, but they become hazardous when used indiscriminately. Every pill consumed should have a clear justification, a specific goal, a defined time frame, and be regularly monitored for both effectiveness and safety. If you automatically take an anti-inflammatory for pain, use a stomach acid blocker for years without questioning its continued necessity, take statins simply because they were prescribed years ago, or combine multiple medications without proper supervision, You are in the high-risk zone that claimed many lives. Self-medication, even with seemingly benign over-the-counter drugs, is a leading cause of treatment-induced complications in older individuals and must be approached with the same seriousness as controlled substances. The purpose here is to alert individuals to observed risks and to guide them towards seeking competent and inquisitive medical care. If you are taking any of the medications discussed, schedule an appointment with your healthcare provider specifically to review each one. Discuss why you are taking it, whether it remains necessary, if the dosage is appropriate for your current age and condition, and if safer alternatives exist. Bring a comprehensive list of all medications you use, including vitamins, supplements, and occasional remedies, as interactions can be fatal. Question everything. How long is this? Medication truly needed? What are the specific risks for my age? Are there natural alternatives I could explore first? How will we monitor if this medication is causing harm? A conscientious healthcare provider will be willing to answer these questions and work collaboratively to find the safest and most effective health protocol. The ultimate aim is not to instill fear of necessary medications, but to empower individuals to be active, informed participants in their own healthcare journey. Medication should ideally be a last resort, pursued after genuine attempts to address health challenges through lifestyle modifications, nutrition, exercise, stress management, and other natural interventions. When medications are necessary, they should be used at the lowest effective dose for the shortest possible duration, with regular monitoring and always with a plan for eventual safe discontinuation. The individual whose story we shared might still be alive today if she had questioned the actual necessity of each medication she took, if she had explored natural alternatives first, and if she had worked with healthcare providers who viewed medications as temporary tools, not permanent solutions. You possess the power to shape a different outcome for your health. This requires becoming an active advocate for your well-being, questioning every aspect of your care, and never settling for medications as an easy answer to complex health problems. For those who have absorbed this information, congratulations are in order. This demonstrates a profound commitment to health that few possess. You now hold knowledge about the hidden dangers of medications, information that countless individuals could benefit from but may never access because they are unwilling to challenge the established medical system. Always remember the sobering account of individuals like the one mentioned. She was conscientious, trusted her healthcare providers, and followed all prescriptions meticulously. Yet, she lacked the understanding you now possess regarding how medications can interact and dangerously accumulate within the aging body. You have a considerable advantage. You know where the risks lie, and crucially, how to safeguard yourself through informed and deliberate choices. The true transformation of your health begins with a simple decision right now. Become an active participant in your medical care, rather than a passive recipient of prescriptions. Schedule a consultation with your healthcare provider, specifically to review all medications you use, questioning the current necessity of each, exploring safer alternatives, and establishing plans to gradually reduce those that are not absolutely essential. Do not be the patient who accepts prescriptions without inquiry. Be the one who asks probing questions, who researches natural alternatives, and who understands that the body is a precious vessel deserving of the best possible care. Educate yourself on nutrition, natural supplementation, appropriate exercise for your age, and stress management techniques that can reduce or eliminate the need for many synthetic medications. An informed and questioning approach can make the critical difference between decades of pharmaceutical dependency and a life of vibrant, natural vitality. Your health is your most invaluable asset, and you possess the undeniable right to fully comprehend any substance you introduce into your body. Medications can be valuable instruments when employed judiciously, but they should never be accepted blindly or used indefinitely without critical evaluation. Truly effective medicine integrates the best of modern scientific understanding with timeless natural wisdom, personalized protocols with holistic prevention, and interventions when necessary with education that fosters autonomy. Many individuals in the past did not have the opportunity to make informed choices because questioning medications was often discouraged. However, you live in an era where information is abundant, and you have the power to make decisions that can add not only years to your life, but genuine life to your years. Take care of yourself with profound wisdom. Question with unwavering courage. And always remember that you deserve the highest possible standard of care. Care that honors both science and nature, that utilizes medications when truly essential, but ultimately seeks health through life choices that nourish and fortify your body naturally.